Okay, so moving on to our 12 lead ECG, previous to the 4 lead ECG we just did on our patient here. So as you can see, we still have all of the limb leads still attached down here and up here. So we'll move on just basically to the chest leads now. So for V1, we're going on the clavicle line, 4th intercostal space on the right. So I'll see if you can see this. On the right, so put it down here. Might be easy this way actually. So feel down 4th intercostal space from the clavicle, usually the 1st intercostal space where the first rib is. So we go down 4th spaces, and it would be about there. Can you see that? Beautiful. V2 is the same perpendicular line basically, but on the left-hand side. So 4th intercostal space down from the clavicle is right there. Beautiful. Moving on, we wouldn't do lead 3, we go to lead 4 instead, which is the 5th intercostal space on the mid-clavicle line. So mid-clavicle line and the 5 intercostal spaces down, that is about there. And in between lead 2 and lead 4, we put lead 3, making sure that they don't touch the leads themselves. These ones do because my patient's a bit small, but make sure they don't touch, otherwise it does affect our ECG, the rhythm it'll create on the rhythm strips and on the parts of the markings. We move on to lead 6, which is on the mid-axillary line, which is underneath the armpit on the left-hand side, on the 5th intercostal space, on the same plane, but underneath the armpit. So it'll go about there. Can you see that? 5th intercostal space goes about there. And then lead 5, it goes in between V4 and V6, which is on the anterior axillary of the clavicle, which is about there. Again, they're not allowed to really touch, but hopefully you can see there, it sort of will wrap around the heart in a sense, trying to get all of the ventricles and all of the fibres leading in, like all the SA nodes, SV nodes, and all the Purkinje fibres, trying to get all of that markings there. So we'd plug all of our leads onto our little markers here and plug it into our monitor here, onto our defib over here. Tell our patient to sit still, take normal breaths, don't worry about what we're doing, and then we would print on our printer to see what we can get a marking on. So once we've printed that out, we're going to analyse the ECG. We're going to do the 5-step method, analysing the P waves, the difference between the QR complex, seeing if it's regular, irregular, those sorts of things. We're going on from our 4 lead, which we thought was a STEMI. We sort of have that idea in mind. So this is the 12 lead we're going to look at. Seeing that there are still elevated ST segments on V5, 6, 3, 4, as we can see here, which is definitely abnormal, which indicates a STEMI definitely on our patient. So we'll tell our patient that because of this ECG, we do believe they have a blockage. To eliminate this blockage, we need to use drugs. We need to thrombolyse this patient. That is involving 3 different types of drugs: tenecteplase, clopidogrel, and there's one more that I can't remember. So we'd use that on this patient, and then we would send away the ECG strip, this strip here. We will send that away to the closest cardiac hospital or into like a pilot or whatever we need to do to get a doctor here to wherever we are. In my area, we would need to get a chopper here because we are a couple hours away from the nearest hospital in general, and get them to try and do some interventions for this patient. So that's all we would do.